welcome to Hope Channel Kenya, Light in the Family. My name is Kanjo Diambo, and this is Positive Living, where we take care of your mind, your soul, and your body. You're a person living with HIV and AIDS. We're here to tell you that it's not the end of the world, but perhaps just the beginning of a wonderful journey. So today we're talking about opportunistic infections, and to help us as usual is the very lovely Brenda Kinyangi. Welcome, Brenda.
Thank you.
Pleasure as always. Brenda is from Adventist Center for Care and Support, located at Nairobi Central SDU Church. And if you have any question, if you're wondering something we did not touch on exercise, on STIs, on mental health, you can contact us via Hope Channel Kenya on Facebook, on Twitter at Hope_Kenya. You can text us via the line running down your screen, or you can just walk to Adventist Center for Care and Support and they will tend to you. So on opportunistic infections, most times, as we already discussed earlier, HIV lowers your immune system, and that gives the opportunity for all these infections to come at you. Perhaps the name opportunistic infections,
Definitely.
What brings about opportunistic infections? At what point does your body just breaks down and all these infections come?
It actually occurs, maybe you've been on medication, or maybe you're attacked. It might be through viral infections, the way we learned. It might be bacterial infection. It also might be parasitic infection, the way we learned the other day. So it's very important. If somebody goes through all this, it means they are prone. So that's why we usually say their immune now is weak, which is like a house without the roof and the windows and the door. So it means any dust that happens around goes in. If it rains, the rain gets in the house and the house becomes messy. So the house is just like our immune system. If it's not covered well, it means it lowers our immune system and we are prone to this, the OIs, that is the opportunistic infections that are there.
And tell us some of these opportunistic infections.
Some of these infections, they are like some of the STIs that are there. We have the oral, which is the candidiasis. It might attack you orally, or it might be yeast infection. Another one might be you are going through fever. It also might be malaria. Yes, it's one of the infection. Okay. Even flu itself.
Just any infection, as
it's
long
an
as
infection.
Your immune system is so low.
Anything that attacks your immune system and it gets low, it means right now you are prone to getting any other infections that are surrounding you, because it means now your body or your immune system is just vulnerable to the things that are happening around.
So what happens to your body when an infection gets to you?
What happens to our body when an infection attacks us? You get the normal symptoms. We have the headache, you can have fever, you can have nausea, you can have vomiting.
Just the usual.
Yes, you can have chills. Others have diarrhea for maybe even for a period of time. And the more you have it, the frequency that you have it, even it lowers your immune system. Others may be having some of these small, like typhoid, also can be able just to lower also the same immune system.
Yeah. And with these opportunistic infections, how does it relate to HIV? Of course, with HIV, your immune system is lowered. But apart from that,
what usually happens when you're attacked or you're infected with the HIV virus itself, under the viral infections, we say what is usually attacked definitely is the immune system. And when it's attacked, some of the things that may be able to get now through your system, because already your immune system is lowered, we have things like pneumonia. Yeah, you get recurrent pneumonia. We treat you today, pneumonia. After a period of time when it's very cold, again you are prone again to getting pneumonia again. We have meningitis that is there. It can also be one of the factors. Unaumwa na kichwa, unaumwa, it doesn't go away. So it's also one of the OIs that are there. We have, under the cancer, we have the Kaposi sarcoma, whereby it attacks you and also lowers your immune system. And also we have TB.
TB.
Yes.
It's like the most common.
Very true.
Why is that?
Tuberculosis itself, it's a bacterial infection. When you look at it, it attacks you through the air where you live. I usually say hygienically, it depends on how clean you are. If you're staying in a place that there are no windows and there's no door, there's no light, there's no air, there's no proper ventilation getting in, it means if somebody is there, or the TB was there, you know, TB can survive for so long, for so many years. Somebody who has TB has stayed in that house before and has never been treated. Yes, it survives. It can survive as long as, I don't know, forever. I can just put it like that. But if we have a lot of ventilation, we have light, then chances of TB surviving there is like nil. And I just also want to encourage people that we should not fear, because you might think, oh my goodness, TB is more deadlier than HIV.
Not live.
But it's treatable, it's curable, and also it's manageable.
And with TB, there is active tuberculosis and inactive tuberculosis.
Yes.
What's the difference?
The active tuberculosis itself, it means the latent, let me start with the latent tuberculosis, or not the active tuberculosis, the way you are. The latent tuberculosis usually attacks the lungs. That's why we say TB, pulmonary TB. It attacks the chest and everything that is there. That's what we usually say. That's a latent or not active TB. But TB itself, it attacks anywhere in the body. Anywhere in the body apart from the hair.
No, please, just expound on that. Anywhere.
It means TB can catch you. We have TB of the skin. We have TB that attacks the lungs itself. We have different, anywhere that you can think like eye, skin, it cannot. TB, you can be able to get TB from anywhere.
So, let's say you have TB of the skin. Are the signs and symptoms different from TB of the lungs?
Wow, that's a good question. Actually, it's not like it's that different, but now the tests that are going to be done, it becomes a bit different, because you might get maybe the TB of the chest or the lungs. Basically, you'll go through sputum. You'll have to remove your sputum. That is the mucus you have to remove. Then it's going to be tested through the lab to be able to show if there are the active TB cells there. Then there's also the X-ray, whereby you have TB and you don't have sputum. Yet you've been coughing for more than the 2 to 3 weeks. You've been coughing. So the only way to know that you are infected with TB is through the X-ray. So you need to go through an X-ray, then you are known. And some of the symptoms that actually relate to TB, we have fever. Fever is there. We have night sweats, whereby you sleep on your bed, you sleep. When you wake up in the morning, you get the bed is wet. You might be thinking, I've wet the bed.
That's serious.
Yeah, that's
sweating. That's serious to wet the bed.
Yes, that's also one cause of TB. Another one, we have fatigue. You're just tired from nowhere. You're just tired. You also have the retention of memory. It becomes a bit. You keep on forgetting, or And most people, when they hear tuberculosis, they usually just put it aside. But it's something very, very serious. It's something very manageable. We don't want to put it that is serious. It's something very manageable. And I just like to encourage all the viewers who are watching right now to know that TB does not only infect the person who's HIV positive.
True.
But also all of us, we are prone to getting TB. That's why you see when a child is born, we usually say that the child should not finish like 6 weeks before they are given the BCG vaccine to enable them just to You know, the TB itself, it's introduced to the body. It's not there. It's introduced so that as you grow up, you know, all of us, we have BCG.
Yes.
I hope you have one.
Yeah.
I hope you have one.
I do have one.
We're usually introduced to it as early as we are born, so that to be able, as we walk, because in this life, it's part of the infection that is there. And for sure, and I don't want to lie about this, is TB kills. But prevention is better than cure. Yeah.
And we talked about hygiene as a practice for prevention.
Very true.
What other practices should we adhere to?
Very, very true. When I talk about hygiene, it's so wide.
Yeah.
Because I've just like mentioned it, but it's so wide. There are steps actually to follow on it. Somebody who has TB should be able to go to a health facility and start treatment immediately. When they start treatment immediately, within some few weeks, at most maybe around a month, it means now they cannot be able to infect somebody else. So you should not have fear of sitting and relating to this person. This person who has TB, in terms of sharing cups and utensils, before they are treated, before they've started on drugs, it means you are highly vulnerable to getting TB if you are living with such a person. Even the way that person coughs, it's very important. You don't cough like... you don't cough like this.
It's just the normal cough.
Yes, you don't cough like this, because some people just cough and then they come and shake your hands. Then you forget, again you touch your nose. You get TB. It's very important when somebody coughs it's better for them to use the elbow just to cough so that to avoid getting others infected. Handkerchief, I'll say it's okay, but after some time it gets wet. Yes, it gets wet. This is the best position actually to do it, to avoid getting others infected with TB.
And you also talked about fearing these people who have tuberculosis, and that reminds me of there's a lot of stigma and discrimination surrounding people with tuberculosis. What would you tell our viewers on that?
I'll tell our viewers, like the way I've just said some few minutes ago, that so long as somebody has already started on the treatment of TB, they are not infectious. But if somebody has not started the treatment of TB and you're living in it, means the whole family in that house or any other person in that house is prone to have TB, and they need to get tested.
And you need to
for
also
TB.
to take care of these people.
Very, very true.
Them.
Very true.
And the more you shun them out, actually, is the more you're prone to getting the disease. Because when will they get to the doctor?
Very, very true.
All these nasty comments about it.
Very true.
And also, let's just touch a little bit on undetectable TB. Is there a point whereby you have tuberculosis but it cannot be detected? That's
why if you can be able to go back, if you can be able to recall, I say there are different ways of screening TB or diagnosis. And I mentioned about the X-ray. I mentioned about the sputum. Yes. And also I mentioned about the X-ray, the sputum, and also if it's a screen test, we have the gene expert, that is just in the medical field, that they usually do for somebody just to be able to access if this person has TB.
So there's no way it can go undetected?
Yes, so long as you go to a facility.
We check with another way.
Very, very true. But what I can be able to say is this: any person who just is just going through the symptoms that I've mentioned, you are coughing for more than 2 weeks. Kila siku unakohoa. Every day you are coughing.
What type of cough are we talking about? Is it throughout the day, or because some people cough so much at night, but then during the day it's normal? At what point do you know, or this could be TB and it's serious, I need to see the doctor?
So long as you cough, you might be able to sit unasema, this homa I've taken 3 days. So long as you've been coughing and you've been trying your level best to get treatment, you've been trying your own concoctions and it doesn't work.
Persistent.
Yes. The continuity of it. If it's more than 2 weeks, kindly go to a health facility and get tested for TB. If you have fever, also it's part of the symptoms. If you have night sweats, it's another symptom. If there's fatigue, it's another symptom. And you know what usually happens with the cough? The more you cough, it reaches a point you are coughing and the vomiting comes out.
Oh.
Yes, so it calls for you just to visit a health facility and get the best care.
Wow, it's pretty serious. Dear viewers, you've had it. Tuberculosis is not something to joke around with, especially as an opportunistic infection, and especially for people living with HIV and AIDS. When you come back, we'll talk more about opportunistic infections, but right now, let us go on a short break. Do interact with us on Facebook, Hope Channel Kenya, on Twitter at Hope_Kenya. Text us via the line running down your screen right this minute, and let us know what you think. Your questions, everything. We'll be back shortly. Hi and welcome back to Positive Living. If you're just joining us, we're talking about opportunistic infections and just how low your immune system can go. And guess what? All these infections are coming at you. And we've talked so much on tuberculosis, but let's touch on general signs and symptoms of opportunistic infections. How do I know I have an infection and I need to go and get tested?
One of the symptoms might be abdominal pains. You might be saying these are cramps. They are normal cramps, yet they are so painful and they are lower on your, almost near your pelvic bones. They are a bit lower, and it really hurts so much. That's also one of the symptoms that somebody might be able to go through.
How persistent are these pains?
It's persistent so long as you've not been treated. It might occur maybe during when you're going to help yourself in the washroom. Also can be able to be one of the signs that is there. That means it means you visit there as many times as possible. It means frequent urination, and also there's so much discomfort when you're having this abdominal pain or cramps that are there. So basically this is just one of the OIs that is showing you my immune system iko chini and I need to get help.
What other sign?
We also have the fever itself. You might be having chills. You might be feeling very cold, and yet it's very hot. It's very, very hot. And people want to undress you. You're putting on so much.
Very cold.
And the coldness just continue going on and going on. Then you might also be weak. You're just feeling weak for nothing. And it tends to accompany itself with fatigue. You're just tired for no apparent reason. Also, we have loss of appetite. You've not eaten, and you are hungry, but you don't have appetite.
Wow. With that, there are people living with HIV and AIDS and opportunistic infections, and then there are also some lifelong infections, perhaps like diabetes or epilepsy. How does a person living with HIV and AIDS just live and with these two very serious things coexisting, perhaps HIV and AIDS and diabetes?
Wow, it's very sad indeed. When you've just mentioned diabetes, I've just recalled a client that I had and was already HIV positive and had been able to live with it for quite a number of years. Only later on to be told when she went, she had headaches, consistent headaches. She went for a test. Again, she was told that she has diabetes. And it was really weighing her down, because she could not believe it that now she has a chronic infection, which is HIV here. And again here she's been told another news that now you are diabetic. It was not really easy for the client. However, after some sessions with her and some psychological support, the client was able also just to deal along with it and move along with it. But what I can be able to say is it's not easy to be able to balance the two, especially now you'll be taking 2 drugs
for 2 different
for the rest of your life. So what I can be able just to encourage others who are watching and might be going through HIV and another different chronic infection, don't lose hope so long as you adhere to your treatment very well, so long as you take a lot of water.
Adherence to treatment is also something that is not very easy. And let me call it backsliding. What if I backslide on my treatment?
We call it defaulting.
Thank you.
We call it defaulting on drugs. When it happens, it also brings, it usually brings, again, when the person is being started again on the drugs, it brings some resistance.
Wow.
So the drug doesn't work well as it's supposed to work. Especially when you look at the ARV itself. When you've already been put on the ARV regime to be taking the combination of drug of HIV, then you get like at nowhere, you say, oh, now me, I'm okay. I'm healed.
You're feeling fine.
Yes, I'm healed.
So you stop.
You stop. You stop. Then after stopping from nowhere, after some years, or I don't know how strong somebody's immune system has been, after some time the person's again immune system goes down. Then they come again, they need again to be restarted again on the art itself treatment. So it becomes a bit hard because the drug already has been used before. So it becomes a bit resistant. It doesn't work well as before.
So I'm guessing you would recommend, if you're feeling fine, just continue.
Just continue by adhering to the drugs. It's very important.
Or would you consult with your doctor so that perhaps the drugs are lessened? Because I'm pretty sure they're numbered. Is that possible?
They're not numbered. Nowadays, things have advanced. It's not like Kitambo during 80s, whereby you had some piles of drugs that you need to consume and take to be able to curb HIV. But nowadays, it depends on the kind of dosage that you've been given, depending on your weight, depending on so many things. But it's not something that is very hard for somebody to adhere. Unless it's just your own perception, you just say, this drug I don't want to take it. Maybe it's too big. But your throat, even your esophagus, it's also big enough. It cannot go, the drug cannot be bigger than your mouth.
True.
So it's just all about swallowing and taking a lot of water, and also just observing the way we said on positive living, that is exercise, eating a balanced diet, fresh air, keeping yourself clean. Very, very important.
On adherence to drugs, let me just take you back a little bit. With tuberculosis, there is some dosage of some really hefty drugs that really affect the individual. What are some of these effects?
The effects, because TB itself, they are very strong drugs. They're almost close to taking the ARV themselves. They are very strong, and I really want to appreciate any person who's taking the TB drugs and what they go through psychologically. I just want to tell them, if the ones who have been through it for the 6 months, kudos to them, because it's something that really, yes, it needs a lot of discipline. Because actually, whatever the drugs usually do, it's like any other normal effect. You get drowsiness once in a while, depending on how you take it. That's why you see I keep on insisting, take with a lot of water, because if you take a lot of water with this drug, what usually happens, it helps the drug just to go where it's supposed to go in your immune system and to work well. And also, what usually happens when you take the TB drugs, some people get reaction. The first time might be rashes, but after some time it goes away. It happens with any other drug. That's the normal rash.
All over the body?
Yes.
Your face, your arms?
It depends on where it will touch you. Other people, it causes numbness. whereby you get somebody says they don't feel this, they don't feel their leg, but because of the drug itself, but after some time it goes off. But also we just like to encourage any person who's taking TB drugs, if they are having these severe effects, they need to come back to the facility and tell their doctor about it, so that we may be able to see now the way forward for them, so that they may be able to continue taking the TB drugs. And the TB drugs, they are not something that you need to start today and you stop before the period that you've been given. It's very important for you to take for the whole period, despite feeling vomiting, nausea,
I miss
fatigue.
I miss a dose.
If you miss, you come back to the facility. We put you under something that is called DOTS.
Dots.
So it means you come every day to the facility, and we monitor you so well as you take your drugs. And you take each day as you take drugs, you take there, I'm there with you. You take the drug.
So I will come back to you each and every single day.
Because you cannot keep on defaulting, because the more you keep on defaulting, you might the results to yourself to being MDR, which means the DMR, which means the drug has become resistant. It can be able to become resistant, so that you get this person who treated them TB, then they stay a bit, again they have TB. The same TB. Then again they stay after some months or some years, again they have TB.
And despite that, what are the chances of tuberculosis recurring?
The chances are there, so long as your immune system is weak. You are prone to infections.
Okay.
Yeah.
And we talked about...
And also another thing, depending on also, sorry to cut you, depending also on the people that you stay, or the area, that the environment that you are in. Because tuberculosis itself, it's bacterial, and it's spread through the air. Yeah.
Okay. I was going to mention the very severe effects. What can I do to lessen the severity of these effects?
If you are really getting affected with the drugs themselves, the TB drugs, I won't want to advise anyone right now who is watching me, but they just need to go back to the facility and inquire from the clinician or the person who's seeing them that anytime that I take TB drug, I cannot move, I cannot work, I cannot eat, I cannot do anything, I'm just there. So that we may be able to see now, maybe there's a mistake somewhere. Is it within
the loss
yourself?
Of appetite or nausea, all those.
Yes.
Okay.
Yes.
And let's we have very few minutes remaining, but tuberculosis and pregnant mothers. Let's say a mother is pregnant and she also has TB, and then these drugs. What happens?
Wow, that's so sad. That's sad, but we thank God. We have the drugs, and they are very effective. Depending on how the pregnancy term is, will depend on how the mother is going to be handled when taking the TB drugs, and also if they're also HIV positive, the HIV drugs. Because this mother already, the immune system is low. Because they're already pregnant, it's low. So it means so many things can happen at this point. The fetus can come out, that is miscarriage. We can get deformities. We can get termination of pregnancies. So I don't want to scare anyone right now, but it's very important. You're pregnant and you have TB. Please finish your medication. Whenever you go to the clinic, visit a PMTCT clinic, which means Prevention of Mother-to-Child Transmission Clinic, so that they may be able to advise you now, I am pregnant, I'm HIV positive, I'm taking TB drugs, then they'll be able to support you quite well.
Okay. Thank you, Brenda.
You're most welcome.
This has been lovely. And thank you, too, for joining us. Thank you for working with us. Do ask us whatever question you have. We're so ready to answer you on Facebook, Hope Channel Kenya, on Twitter at Hope_Kenya, via the line running down your screen, and we'll be able to answer you. Your comments, your questions, everything. Next time, we touch on drug or substance abuse. Stay tuned. I've been your host, Candy Odhiambo. Until next time.